Hello and welcome to Anatomy with Dr. P. In today's video, we're going to be looking at the vessels that form the hepatic portal system. Now, as you can tell, we're really zoomed in on the model here so that we can tell some distinct differences between the vessels. Here in red, these are going to be our arteries. The blue vessels that we see are normal veins, and then these purple colored vessels are going to be the veins of the hepatic portal system. Now, coming out of my spleen, I have this very large purple vein here. This is known as the splenic vein. That's our first vein of the hepatic portal system. Attached to my splenic vein, I can see this little purple nub. That's going to be my inferior mesenteric vein. And as we discussed in a previous video, the mesenteric arteries and veins are actually very large. They're just shown very small on this model. Our inferior mesenteric would be running down to the mesenteries of the intestine and the large intestine, so they're draining those two organs. As I continue over, this very large purple vessel here is the superior mesenteric vein. The superior mesenteric vein is going to be draining deoxygenated but nutrient-rich blood from our small and large intestine. Now, all three of these veins, our splenic vein, our inferior mesenteric vein, and the superior mesenteric vein are going to merge together into this purple vessel that's running into the liver, which we call the hepatic portal vein. Now, that word portal is important in anatomy. A portal vein is a vein that runs between capillary beds in one organ to capillary beds in a second organ before continuing onto the heart. That makes it different than a normal vein. Normally we have an artery, goes into an organ, and then a vein drains that blood back towards the heart. But here we have an extra organ before we go back to the heart. And in the hepatic portal vein case, that extra organ is the liver. Now, the liver's primary job in the body is detoxification of the blood, along with hundreds and hundreds of other functions. But for our purposes, we're going to focus on detoxification. Now, where is blood coming from in this hepatic portal system? Well, it's coming from the spleen. The spleen plays an important role in fighting infections. It's coming from our stomach, our pancreas, our small and large intestines. The stomach, the small and large intestines are all involved in absorbing things out of the food that we eat. What I'm trying to get at here is that blood can potentially have problematic things in it. From our spleen, it could have things like microorganisms that could cause us infection or other harmful compounds. And from the stomach, small and large intestines, it could have toxins from the food we've ingested. So before we send that blood back into the inferior vena cava and send it right to the heart, where we're going to pump it out to the whole body, we want that blood to go through our liver first so that we can detoxify any potential harmful substances before it drains through our hepatic veins and back into the inferior vena cava. Now, understanding the anatomy here is important for anyone planning to go into a medical field. And the reason for that, if we think about ways we can take medication, if I give someone an injection or a sublingual strip, which means they just put it underneath their tongue, that medication is going to go directly into systemic circulation and be pumped throughout the entire body. But if I give someone an oral medication, so a pill, that pill is going to come down into the stomach region where it's dissolved by stomach acid and then pass into our intestinal tract where it's going to be absorbed. And as it's absorbed into the blood, it's going to go to our liver for processing. What ends up happening for most medications, at least part of that medication will be metabolized in the liver. In other words, it will be destroyed before it gets into our inferior vena cava. That's why when we look at medication doses, usually what we see is oral dose medications have a higher dose than if the medication is injected or given as a sublingual strip, because we have to give enough medication so that enough will make it through the liver and into the inferior vena cava to cause the effect that we want to see in the body.